So we've gone through a few tests and measures here, and we have discovered through the test and measure signs and symptoms that the patient is presenting with tight neural tissue, specifically of the posterior interosseous nerve branch of the radial nerve. And she also has a little bit of deep Quervains tenosynovitis going on in the first extensor compartment of her left arm. So I'm going to demonstrate some manual techniques that we can do for both of those issues. So essentially what I'm going to do for this first one is mobilize the posterior interosseous nerve. So I'm going to go into what we call just a typical neural tension test. Okay. So what I do with this arm is I'm going to compress the shoulder. I'm going to make sure that the wrist is flexed. The forearm is pronated, like so. Press the shoulder. I'm going to bring it down like this. And as soon as I get that wrist flexed, my patient is going to start to feel that irritation as I extend this elbow. And then if she moves her head, her right ear to her right shoulder, she's going to feel that even more. So the point here is that I'm going to try to mobilize this tissue. So as I bring the wrist into flexion like this, she's going to bring her left ear to her left shoulder. And then as we go into extension, she's going to bring her right ear to her right shoulder. We're going to go back and forth in sync here. Good. And we're probably only going to do this a few times, maybe 10 to 15 reps, because this tissue is very sensitive, and with somebody who's having pain with that, that tissue is going to be tight. So the point there being to move it. The next thing I'm going to do is just a simple cross-friction massage technique. You can do this with A-stim or Graston tools, but typically what I want to do here is I'm going to do a cross-friction massage on the tender point. So if she's having pain, especially at the base of the thumb with those tendons, I'm going to make sure I find those tendons, and then we're just going to do a cross-friction massage for about anywhere from 2 to 3 minutes over here. So you want to go perpendicular to the way that the tendons are running, and what I'm trying to do here is essentially initiate inflammation. So right now, especially if this is a chronic injury, it's stuck in that inflammatory phase of tissue healing. So my goal here is to bring the cytokines, the histamines, and some of the inflammatory response there, so we can hopefully move it on to the proliferative stage of tissue healing. Towards the end of the session, we would then apply some ice to hopefully get that down and control that at the end of the session. But those are two manual therapy techniques we can do for both issues.